Hey there, my name is Dr. Justin Marchegiani. I have a practice in Austin, Texas, and primarily practice telemedicine. So I'm doing functional medicine all over the country, all over the world with patients from, everyday average person trying to improve their health to your typical menopausal woman to people with chronic adrenal fatigue or adrenal dysfunction. And then we're trying to get to the root cause. So we're trying to utilize nutrition, supplementation, functional medicine principle, philosophy, getting to the underlying issue. And on the hormone side, using the Dutch testing has been really great over the last 5 or 6 years, assessing adrenal function / dysfunction, looking at hormonal imbalances, looking at hormone detoxification, and then even able to use some of the organic acid portion on the Dutch as well to kind of help look at neurotransmitters, adrenaline, serotonin, dopamine, oxidative stress, some of the methylation markers on there as well. Really, really key.
So, what inspired you to become a healthcare practitioner?
That's a great question. I would say out of the gates, I worked in conventional medicine for a while. I was the person that would be in the surgical room that would come in to kind of hold their position in a patient, especially during a lot of amputation procedures for diabetes and gangrenous limbs. And so I kind of just started asking questions like, hey, how can we get in front of this and try to prevent a lot of this from happening? Because in the conventional medical mindset, you just kind of have, hey, this is what you do. This is your lane. You kind of stick in it. And these are the things you do. And there wasn't really that thinking upstream of how you can be on the prevention side of it. And so I just asked questions, and then that kind of led into different realms of natural medicine, chiropractic, functional medicine, nutrition. And then as you kind of accumulate these tools as a provider and a practitioner over a decade or so, you start applying it to your patients, and you start able to have great success with clinical issues, from hot flashes to menopause to chronic digestive autoimmune gut issues, because you're really getting to the root underlying issue. Now, we're not practicing medicine, we're not treating disease, we're not prescribing drugs, we're trying to fix upstream physiological imbalances that are really root to all of these downstream symptoms accumulating.
What is your training officially, and kind of where did you go to school? And
good question. So yeah, my doctorate's from Life West University, doctorate chiropractic medicine. I did pre-medical studies and the whole 9 yards there, and just lots of postgraduate education in functional medicine and nutrition, because you're just not going to get enough of that no matter where you go. So just lots of different postgraduate seminars and classes and courses and lots of books. And again, my site at justinhealth.com, I do podcasts where I interview guests from all over the world and create videos and content where I interview guests, and also just providing really good information. So that's a good resource as well. And that's where I've kind of interviewed a lot of great people there too. So just over time, over a decade or so, just really accumulating lots of evidence and information. And then the most important thing is applying it, because you can get lots of factoids they kind of sound nice, but how do you clinically apply it to get your patients well, right? That's really the key. And so it's a combination of the knowledge, but also applying the knowledge is really important.
And then do you do any other functional testing in your practice?
So my practice, I kind of break it down. It's the model was kind of inspired by Dr. Dan Kalish, but it's kind of the 3-body system model, pretty simple. I've kind of modified it and adjusted it for myself, but I kind of break up body system 1 is really looking at the hormones, and that could be ATM or ATF, right? Adrenal thyroid female hormones, adrenal thyroid male hormones, depending on who you're dealing with. And so we're going to look at adrenal function. A part of adrenal function is looking at cortisol rhythm. I was a big proponent, in the early 2000s, even looking at salivary adrenal testing, it's nice. And then Dutch came along, and then that gave us the ability to look at the total fraction of the hormones, which is really cool, because you can not look at just free, which is good, but you can look at total hormone fraction, which you typically only could do that via, I think, blood in the past. And now with the urine, you can kind of do both free and total. So really looking at adrenal function, cortisol rhythm, also looking at hormone metabolites. The cool thing I do like about the Dutch Complete with the hormone side is I can also look at metabolites in regards to how a person or woman or man is metabolizing estrogen, for instance. That's really cool. So I can get a pretty good gauge of how their methylation is, and if they're a slow metabolizer, that can give me more information if they're going to be put more into estrogen dominance. Of course, all the hormone levels, estrogen, progesterone, E1, E2, E3, DHEA, all your androgens, all very helpful. So that's kind of body system 1. Of course, for the thyroid, we'll do like thyroid blood testing to really get a window into the thyroid, TSH, T4, T3, antibodies, etc., reverse T3. And then for the male or female hormones, I'm typically relying on a lot of the Dutch Complete. Sometimes I'll draw blood as well, just to see and compare. And so that's kind of body system 1. That's where I plug in the Dutch testing. And then body system 2 would be really looking at the gut. So digestion and infections. And there's a couple tests I look at there. GI map is one that I like a lot, but to look at gut infections, dysbiosis, fungal overgrowth, yeast overgrowth, parasitic infections, H. pylori, enzyme levels, how we're breaking down fats and proteins, very helpful. There's breath testing that I'll use as well to get a window wrapped around SIBO. And then I do like organic acid testing. That's wonderful for different metabolic pathways, B vitamins, methylation, detoxification, certain nutrients, energy production markers. Also, really good window into gut bacteria and yeast overgrowth and some of the dysbiosis markers there. So those are kind of the big three systems in the test that I'll plug in. There's more, but that's kind of a brief overview there.
So how would you say chiropractic, your practice kind of differs from your naturopathic peers?
Well, chiropractic for me, it provided a really good foundational vitalistic philosophy, right? And that's kind of the philosophy I think that functional medicine sits on, right? Vitalism is the fact that your body can heal itself. Your job as the doctor, the provider, is to help kind of remove the stressors. Now, I kind of always compartmentalized, everything I did is like physical, chemical, and emotional stress removal, right? Physical stress, chiropractic was amazing at the physical stress because it was, addressing subluxation and making sure joints were moving, and that helped the nervous system communicate, and that helped with blood flow and healing and oxygenation. So wonderful for neurological, musculoskeletal stuff. And again, lots of miracles happen with chiropractic, but you see other issues and other symptoms improve that you wouldn't think would be connected to just musculoskeletal. So chiropractic was phenomenal, but I saw the fact that patients were coming in that had all kinds of gluten sensitivity and food allergens and gut infections. And I started seeing lots of women that had lots of PMS, menopausal women that had lots of hot flashes, mood issues, sleep issues, libido issues. And I just needed more tools in my tool belt because I just wasn't getting all the results I needed with just that one tool. So chiropractic was a great tool, but then applying other tools to help these other kinds of patients that were coming in. And so, of course, diet was a big component there, utilizing supplements to help work on the physical imbalances. Because my philosophy is you have all these stressors, physical, chemical, and emotional stressors, right? Physical could be chronic pain, sedentary, could be trauma from a car accident, old sports injury. We have the emotional stresses, which are pretty straightforward, right? This is going to be work, family, relationships, finance, money, that kind of stuff. And then the chemical stressors were the big things that functional medicine plugged well into. These are like gluten sensitivity, heavy metals, mold issues, gut infections, SIBO, inadequate digestion, low stomach acid, enzymes, hormone imbalances, poor detoxification of hormones. So that's kind of where everything plugged in. And so I just wanted to grab more tools for myself so I could help my patients that weren't getting better get better.
So what are the changes that you've seen in your patients in practice since you started incorporating the Dutch test?
Well, I've been doing the Dutch test. I think it came out, 2000, maybe 14, 15. The big difference, I think, I was doing salivary testing for a long time. I like salivary testing. It was nice. It was convenient. You have a pretty good window with the free fraction testing of the cortisol, right? 2 to 5% of all cortisol is free fraction. The other 95 to 98% is going to be, your protein bound. And so the nice thing about the Dutch testing was you could look at the free fraction, which was nice. That's biological. That's kind of what's available functionally, as I explain to my patients. And then we have the total fraction, meaning what your whole body is making. Because there's a lot of times you see patients that have a very high level of free cortisol, right? But they have a very low total level of cortisol. And that's nice, because if someone has very high level of free cortisol and a low level of total cortisol, we may not want to one, there could be a thyroid issue or a potential anemia going on. So it gives you a window. There could be other issues happening. And usually when I see a big imbalance of free to total or total to free, it tells me HPA access issues. And it kind of helps guide treatment a little bit better. Because when you look at free or total, you look at free cortisol being high or low, you kind of just assume that total cortisol is high or low in alignment with it. But a lot of times you see the inverse, and it's kind of nice to be able to know what's happening. One, to get a window into what's functionally bioavailable on the free side, and then what's, let's say, how your overall adrenal function is doing from a total reserve capacity. So it's nice to be able to look at both, and it really helps with treatment.
So would you say that Dutch is your baseline test, or do you do any follow-up testing afterwards?
It depends. So a lot of patients, they come in and we get a window of what's happening. We fix diet and lifestyle factors. We start supporting hormones. We fix underlying gut infections and imbalances. We fix digestion, any toxicity, detoxification, nutrient issues, and patients feel better. Over 6 months, they're feeling much better. So it's a combination of one, how how bad their test was to begin with, and hey, let's look and see where you're at. And then a lot of it is, well, the patient just knows they're better. They just know they're feeling better, and the question is it worth retesting? And so I always tend to urge to it, but it depends upon how much better the patient feels. And most of the time they're like, hey, I'm good. Well, let's put that money towards maybe more treatment or some other test. But then anytime there's something that's more severe, I always want to push for that retest to know. But a lot of times patients, they feel better. It's hard to get someone motivated to retest when they know internally they're doing really great.
Yeah, absolutely. Test off the symptoms. So how do you practice so virtually when chiropractic is so hands-on?
I don't do chiropractic anymore. I haven't done chiropractic in maybe 7 or 8 years, like from a physical standpoint, like physically in office. There's a couple people I do treat, my wife and family and some other close friends, but for the most part, just functional medicine, 100% virtual right now. That's it.
Oh, that's incredible. So
yeah, I mean, basically what happened was I had like my certain days for chiropractic on my calendar and then certain days for functional medicine. And because when you're doing chiropractic, you're only working on the people in your area, right? Functional medicine, being virtual, I could pull from everywhere, right? So it was a supply and demand issue. You just had a lot more people on the functional medicine side available to you, because I do telemedicine, than who's in your local area. And so of course, supply and demand, my schedule just filled up with functional medicine. And I do love functional medicine. I like chiropractic and functional medicine. But functional medicine is it's special because almost anyone that has a chronic health issue isn't doing the right things at a foundational level. And part of functional medicine is getting people to really make good changes in their health and their eating and lifestyle habits.
Yeah, absolutely agree. So where is your farthest patient, would you say?
Oh, I mean, Australia, New Zealand, Asia, everywhere, really. Europe.
So where do you see functional and integrative medicine heading 20 years from now?
It's a great question. It just depends, right? Because you have this competition with, okay, conventional medicine does their thing, and then functional medicine kind of does their thing. But I think the problem with conventional medicine and functional medicine is if people really get healthy and make healthy habits, you're going to need less conventional medicine. You're just going to need it because most of what conventional medicine is doing is treating chronic degenerative disease, right? Chronic inflammatory conditions. And we know functional medicine is really good at helping with chronic degenerative inflammatory conditions. The more we support nutrition, digestion, healing, recovery, nutrition, digestion, people get better and they're not going to need a lot of chronic medicine support. There may be some, right? Now, again, there'll always be a need on the allopathic side for acute traumatic medicine. That's where they really shine. Car accidents, falls, things like that. But I do think there's this kind of push and pull kind of competition with conventional medicine just because functional medicine will require less people to need chronic allopathic medicine support, just because when you get better and you get healthier, you don't have as many symptoms going on that you're trying to manage. So it's kind of up in the air. It's going to really depend upon how much conventional medicine embraces it or how much they look at us as kind of like adversary and wants to compete with us. I think we could definitely harmonize more, but there's a lot of corporate alliances there that may make it hard for us to join. So it's hard to say right now.
Yeah, in a perfect world, right?
Yeah.
And then what do you like to do outside of work, outside of functional medicine?
That's a great question. I mean, I have 2 young boys, age 1 and 3, so a lot of family time. That's going to be most of what I do. I like to do water skiing. I like to do a lot with real estate. I like to do a lot in business and coaching other practitioners and doctors, and just learning myself, right? Just always trying to grow and learn and just make sure I take care of my health and be an example to my patients. There's a lot of doctors that I think let themselves go or get too stressed or don't practice what they preach. And I think as a clinician, you really there's a lot of fields out there where you can be, you can be a banker, but you don't live banking, right? But as a functional medicine or a natural healthcare provider, you really want to live what you do so you can be an example, right? It's one of those unique professions that you really have the ability to live it as well as do it for your work.